Hello pharmacists, woman health worker. Welcome to Learn with Purple Pharmy. Today let's do a fact check episode. We recently heard a news that children died in Madhya Pradesh after being given cough syrups, and health advisory was released to stop using cough syrups in children less than 2 years old. What are the facts and findings here? Let's have a quick deep dive. What happened in MP and neighbouring states? In Chhindwara, MP, several children died of acute kidney failure after being given a cough syrup brand Coldrif that was later found to be contaminated with diethylene glycol or DEG. DEG is a toxic industrial solvent used in antifreeze etc. that can cause serious organ damage. It is strongly suspected that the cause of the deaths is contamination, specifically DEG, in the syrup. That is confirmed for a particular Coldrif batch. However, in other regions or for other cases, full confirmation is still pending, especially whether all deaths were caused by the same contaminated batch, or if there were other contributing factors, example environmental, underlying infection, water, etc. The implicated batch is SR13, manufactured in May 2025 by Srizon Pharmaceuticals in Tamil Nadu. The expiry date was April 2027. Tests by laboratories found very high levels of DEG, around 48 to 49% in one reported test in that batch of Coldrif. As a result, the MP government banned the sale of Coldrif syrup and some related medicines from that manufacturer, seized existing stocks, and initiated legal regulatory actions including registering FIRs, arrests of certain officials, doctors, and stricter oversight. After these incidents, the DGHS, Directorate General of Health Services, and other health authorities in India issued advisories saying, cough and cold syrups should not be prescribed or dispensed for children under 2 years of age. Here comes the big question. Are cough syrups not allowed for children 2 years and below? For children up to about 5 years, use of such medications should be avoided unless clearly indicated after clinical evaluation, with very careful dosing, shortest duration, etc. It is better to avoid multi-ingredient, combo, syrups, i.e. many active ingredients combined in a single preparation. Single ingredient treatments or symptomatic relief are preferred. These advisories are recent and in response to the tragedy, so it's not that there was a long-standing law universally banning all cough syrups under 2 years, but many medical guidelines had cautioned against their routine use in infants, especially under 1 or 2 years, especially when the illness is mild. Medical context reasons behind restricting cough syrups in very young kids, especially infants and toddlers, include vulnerability to dosing errors as their body weight is small. Even small amounts of harmful substances or overdoses can have large effects. Their kidneys and liver are less mature, so they may not deal with toxins as well. Many coughs, especially those from viral infections, are self-limiting or lack proven benefit. They often get better without medication, especially in young children. Supportive care like hydration, rest, humidified air, etc. is often safer. Some cough, cold medicines have ingredients like certain antihistamines, decongestants, dextromethorphan, etc. which are not recommended or have higher risk in young children. Long story short, cough syrup use in children under 2 years is basically advised against. It's not a blanket ban for all cough syrups ever, but strong medical advisories and regulatory warnings are in place. The FDA has long advised that cough and cold OTC medicines containing decongestants or antihistamines should not be used in children under 2 years because of risks such as rapid heart rates, convulsions, breathing problems, and death. Therefore, non-medicinal measures like rest, fluids, hydration, humidifier, saline nasal drops are first line in children with cough and cold. Well, pharmacists, wishing you all the best in applying these insights. Please feel free to ask your questions or provide suggestions in the comments section. Happy learning. Thank you from Purple Pharmy.